eyelid muscles movement and autonomic manifestations like salivation. In any type of the toxicity, maybe a OCC, OPC, synthetic pyrethroid, there will be salivation, there will be convulsion, there will be excitation, all these things will be there. So, hence it is very difficult to differentiate the diagnosis. Locomotor disturbance like stiff gait, incoordination, ataxia, etc. will be there. Hence, it becomes very difficult for us to differentiate, because the clinical signs are same in almost all the toxicities. In severe toxicity, we can never differentiate any of the things. In field conditions, you might have already undergone so many toxicities, and hence some of the symptoms what here they are mentioned need not come exactly. Sometimes they may be depicted or may not be depicted also, depending upon the type of the pesticides. So, OCC pesticides are the first chemical used as insecticides, and nowadays the OCC compounds decreased drastically due to the reason that they are persistent in the environment, and also the emergence of newer and newer pesticides like synthetic pyrethroids, because the margin of safety is better than that of the OCC or OPC compounds. So, these are all some of the examples which to the different categories. No one can remember it, but just go through the slide, so that whenever a case comes and other thing, then you can see that yes, at least this category may be. So, all these dips etc. Apart from this one, earlier the lindane etc. were used in the animals. Nowadays totally they have been withdrawn from the market because of their very high toxicity and available of the newer and newer insecticides like fipronil and the ivermectins and so many other things. In spite of this thing, why we have to worry? Sometimes the farmers bring this bottle from the agrochemicals and spray it to the cattle, and many times the toxicity will happen. That is why we should know the active principles, the line of treatment, and the diagnosis of this particular thing. And of course, the toxicity is also reported in the human beings. Just this is the endosulfan episode, it happened in Kasaragod and the children born. The first and foremost line of treatment for any of the toxicities of insecticides or pesticide is to wash the animal with mild detergent, not the strong detergent, prevent human exposure during washing. That is the number one. We have to wash the animal with a pipe of the water flowing in a pipe, or simply make some solutions of the soap and wash it thoroughly, so that the further dermal absorption may be reduced to higher extent. That is number one. Then the administer activated charcoal and sometimes the cathartic agents, because the activated charcoal is available in every hospital now. Only thing is, activated charcoal has to be drenched very, very carefully. That is always the better. The veterinarians has to drench it whenever there is a struggling etc. Then there is a chance of the aspiration pneumonia, and many farmers undergo this thing. And ruminotomy is always suggested, which may be difficult thing, but in most of the acute poisonings, the line of treatment, even though antidotes are there, we cannot save the life of the animal, because once it is absorbed, and it will go on absorbed in being in the rumen. Hence, we have to administer the recurrent antidotal therapy if it is there, or else no antidotal therapy, then there is no problem. And only 5 to 10% of the insecticides have got the specific antidote, or else they do not have. Even though there is a specific antidote, it is very, very costly. So, we will see what are all. And ruminotomy is suggested, that will save the lot of animals immediately after encountering the poisoning etc. Maybe if it is in the not in the coma stage or other thing, better to conduct the ruminotomy. I think Dr. Manjunath may tell, especially while his talking is there, because this is what it is recently suggested, that when it absorbs the circulation, then all the clinical signs starts happening. So, when the poisoning material is there in the rumen especially, then we have to remove the entire ruminal content, put the curds inside, then treat with the antidote or whatever it may be, so that the animals can be saved. So, many times the farmers will never cooperate, but if you do the practice and save some of the animals, then they may cooperate, because it depends upon your technical challenges and skills etc. Then you have to convince it. And The first and foremost is the seizure convulsions or convulsions will be too much, especially in this thing, and we have to stop with many of the anticonvulsant drugs, and one of the best anticonvulsant in most of the field condition is diazepam, or else if thiopentone sodium is there, they are all very short acting anticonvulsants, but diazepam is better, but once as the poison is going on increasing, we have to give the several doses. That is why if you give the diazepam at the rate of 1 milligram per kg IV or IM, then after 5 or 6 hours once again it relapses. That is why we have to give the anticonvulsants, because if the convulsion is more and more, then what happens, the absorption will also be more and more, because the cardiac pumping will be more and more. Hence, these are all the three basic 4 things, followed by then we can go for the specific antidotal therapy if it is available for a specific the toxicity is concerned. Diazepam is always recommended in any type of the toxicity, because whenever there is a convulsions or there may be excitation, too much excitation, because most of the pesticides pass the blood-brain barrier and cause the seizures and convulsions. So, it is helpful. The calcium borogluconate is only useful in case of the organochlorine toxicity, because it prevents the liver damage. Hence, the calcium borogluconate may be given in this toxicity only, or else in the OPC toxicity we should not give the calcium borogluconate, because the convulsions may be increased. Whereas in the OCC toxicity we can give. Whereas the important thing is we have to place the animal in comfortable area, so that we have to minimize the trauma and seizures. Then most of the time after recovery, you might have seen that the ruminants become totally anorectic. They will never eat anything, even though you transfer the curd, etc. That is one of the important thing, and we can administer the curd transfusion or ruminatorics like metoclopramide and some of the other, especially the vitamin B complex vitamins, and lot of fluids has to be administered, which is done in case of human beings. In case of human beings, the omission will be induced by the gastric tube and gastric lavaging, whereas in case of cattle it is very difficult. I am talking only about the cattle, whereas dogs, etc. can be done to some extent, but very carefully you have to insert the endotracheal tube and get it done. And so in the OPC compounds, the TIC20, they are just like phenytoin, etc. are very, very poisonous. Within 15 to 20 minutes the animal may die. Hence, we should treat it very fast, just like this malathion and sumithion, all these things are there. And there will be a CNS signs like too much anxiety, restlessness, hyperactivity of that animal, and stiff gait and all the other things. All the parasympatholytic actions means the intestinal spasms will be increased to a higher extent. There will be defecation, then followed by muscle fasciculation, too much salivation, then some animals may also become blind and aiming towards the inanimate objects also. So, atropine sulfate only can be given in only 2 type of the pesticide toxicity. Number 1, organophosphorus pesticides. Number 2, carbamate pesticides. None of the others. Only 2 pesticides. So, whereas many of the veterinarians, I think even though we are taught, they have been taught in the UG that the antidote or it cannot be told as the antidote, but atropine sulfate has to be administered only in these 2, or else I have already told the toxicity of the atropine sulfate. So, never use the atropine sulfate in any other toxicities and also the plant toxicities. I have receiving the phone calls from the field veterinarians that the animal has succumbed with some of the plant toxicities and they have administered 120 ml repeatedly they are administering, and what happens is whenever there is a rumen stasis, etc., then more and more poisonous material will be absorbed into the circulation. Hence, never administer atropine sulfate to any of the cattle. If it is confirmed this organophosphorus and carbamate, then you can, or else no atropine sulfate should be administered. The dose, etc., are already in the slide. So, once again I am repeating the terminology that never use atropine sulfate in any plant toxicities, because I am getting the inputs from many of the doctors that they are administering. So, please spread this message among your friends, etc., so that they at least of course, we cannot educate the livestock inspectors for any toxicity they are administering the atropine sulfate, thinking that it is a universal antidote, but at least vets being the technical persons, we should update our knowledge to the current era is concerned.